It doesn't start with chest pain. Not always. Sometimes it begins with a sigh, a missed breath, a tiredness you can't explain. You brush it off, tell yourself you just didn't sleep well. But deep inside, your heart may be telling you something else, something far more serious. If you're over 70, your heart has been with you through a lifetime, through joy, heartbreak, raising children, surviving hardships. And yet, even this powerful organ can start to struggle quietly, without any grand announcement. Today, we're going to talk about 5 silent symptoms of heart disease that seniors often ignore, not because they don't care, but because they've been told to be tough, to endure, to not make a fuss. But this video might just change that. It might help you recognize a signal that saves your life, or the life of someone you love. So, if you're over 60, or you care for someone who is, please stay with me until the end. These are not dramatic signs. They're subtle, easy to miss, and yet incredibly important. Your heart has carried you this far. Now, let's learn how to protect it. Together. Why seniors often miss these signs? We've been taught that heart attacks always come with a dramatic collapse, gripping chest pain, or a sudden call to 911. But the truth is, heart disease can be far more subtle, especially in older adults. According to the American Heart Association, nearly half of all seniors with heart disease experience atypical symptoms, meaning they don't feel what younger patients do. Why does this happen? Because as we age, the nerves that carry pain signals may become less sensitive. Our bodies also adjust slowly to chronic conditions, so we adapt to fatigue, weakness, or breathlessness, and call it normal aging. But here's the hard truth. Not everything that's common is normal. Fatigue, indigestion, or even jaw pain can be signs of something much more serious than getting older. Let's start with the first silent symptom you should never ignore. Silent symptom number 1. Persistent, unexplained fatigue. We all feel tired sometimes, but when that tiredness sticks around for weeks, interferes with your daily life, and doesn't improve with rest, it may be your heart, not your age. When your heart can't pump efficiently, your muscles and organs receive less oxygen. The result? You feel wiped out doing simple tasks, like brushing your teeth, climbing a few steps, or even talking on the phone. Meet Linda, 73. A retired teacher who walked every morning, cooked dinner for her grandkids, and loved gardening. Until she didn't. She started feeling exhausted all the time. Not sleepy, just bone-deep tired. Her doctor initially thought it was depression or anemia, but after further testing, they discovered early-stage heart failure. Fatigue like this isn't fixed with naps. If you feel like the energy is draining from you for no reason, don't dismiss it. Listen, because your heart may be whispering for help. Doctor's tip: track your energy levels. If you feel unusually weak doing routine activities or need to rest more than usual, it's time to talk to your doctor, especially if it's accompanied by shortness of breath or swelling. Silent symptom number 2. Shortness of breath, especially when lying down. Have you ever found yourself slightly out of breath just from walking across the room or getting dressed in the morning? Or maybe you lie down at night and suddenly feel the need to prop your head up with an extra pillow just to breathe more easily. This isn't just about being out of shape or getting older. It could be a warning sign that your heart isn't pumping as efficiently as it should. Shortness of breath, especially when lying down, is a classic symptom of fluid buildup in the lungs. a hallmark of congestive heart failure. And the tricky part? It doesn't always show up in dramatic ways. Take Mr. Nguyen, 76. A retired engineer, he started noticing that he needed to sit up in bed to sleep. Just indigestion, he thought. But during a routine checkup, his doctor heard fluid in his lungs. It turned out his heart's left ventricle was struggling, causing backflow of blood and pressure in his lungs. His shortness of breath wasn't just a nuisance, it was a silent alarm. Doctor's insight. If you find yourself needing to sleep with more pillows, feel winded from light activity, or struggle to catch your breath at rest, please don't ignore it. These subtle breathing changes could be the earliest sign your heart is in distress. Silent symptom. Number 3. Digestive issues, nausea, or loss of appetite. We often think of heart problems as pain in the chest, but for many seniors, especially women, the early symptoms can feel like they're coming from the stomach. Nausea, a heavy feeling in the upper belly, bloating, even a sudden lack of interest in food. These might sound like digestive issues, but when the heart doesn't get enough oxygen, the digestive system is often one of the first to be affected. Take Susan, 79. She began skipping meals because she just didn't feel hungry. She blamed it on stress, but her daughter noticed she was looking pale, tired, and losing weight. After some tests, doctors discovered she had been experiencing micro-heart attacks, tiny blockages that never caused chest pain, but still damaged her heart over time. The gut and the heart are more connected than we think. When your heart is struggling, your digestive system might send the first clues. Doctor's tip. Don't assume it's just indigestion or age-related appetite loss. If you feel bloated, nauseous, or lose your appetite suddenly, especially if combined with fatigue or breathlessness, speak with your doctor. Silent symptom number 4. Jaw, neck, or upper back. Pain, chest pain, is the symptom we all watch for. But for many seniors, especially those over 70, the warning pain doesn't show up where you expect it to. Instead, it may show up as an ache in your jaw, neck, or upper back. Dull, persistent, and seemingly random. It might feel like tightness in your throat, or a sore muscle near your shoulder blade. You might even visit a dentist thinking you have a tooth problem, when it's really your heart. Let's talk about Alan, 80, a retired shop owner. He had been waking up with pain in his jaw and upper neck for weeks. He assumed he was grinding his teeth in his sleep. But during a visit to his cardiologist, a stress test revealed poor blood flow to his heart. The pain was a referred signal, a red flag being sent from his heart to another part of his body. This kind of referred pain is common in older adults, and sadly, many don't connect it to heart health. Doctor's advice: if you're experiencing unusual discomfort in your jaw, neck, shoulders, or upper back, especially if it comes with fatigue or shortness of breath, get checked. These areas often mask heart-related pain in seniors. Silent symptom number 5. Irregular heartbeat or fluttering sensations. Have you ever felt your heart skip a beat, or suddenly race for no reason while you were resting or watching TV? Most people describe it as a flutter, or a little bird flying inside their chest. Others say it feels like their heart is pounding louder than usual, or stumbling, like it forgot how to beat. And yes, occasional palpitations can be harmless, especially if you've had caffeine or feel anxious. But for seniors over 70, irregular heart rhythms can be a serious warning sign. They could indicate atrial fibrillation or other arrhythmias, which significantly increase the risk of stroke and heart failure if left untreated. Consider Maria, 74, a retired nurse. She occasionally felt her heart racing while sitting in her garden. She dismissed it as anxiety, but after nearly fainting one afternoon, she visited her doctor. Tests revealed she had been living with atrial fibrillation, silently, for years. She was lucky to catch it before it led to a stroke. Irregular heartbeat might not come with pain or discomfort, but it is a sign your heart's electrical system may be misfiring. Doctor's insight: if your heart feels like it's skipping, racing, or fluttering, especially if it happens frequently, or with lightheadedness or fatigue, don't ignore it. A simple EKG test can reveal potentially dangerous rhythms that you might not feel at all. When these silent symptoms combine, what it really means. Individually, these symptoms, fatigue, breathlessness, digestive trouble, strange pains, and fluttering, might not seem serious. But when more than one of them starts happening together, your heart may be struggling to keep up. The scary part: many seniors experience these symptoms gradually. So gradually, in fact, that they begin to think they're just normal aging. But aging doesn't mean losing your energy, struggling to breathe, or feeling dizzy and weak. Those are not normal. Those are signals. In fact, many seniors only get diagnosed with heart disease after a hospitalization because they didn't know what to look for. But now you do. You've just learned how your body quietly whispers before it screams. That's power. That's protection. And most importantly, that's hope. What you can do today: protecting your heart after 70. Let's be clear. Aging is a gift. Reaching your 70s and beyond means you've lived through decades of memories, growth, love, and experience. But your heart deserves care now more than ever. And you don't need big changes to make a big difference. Here are some powerful steps you can start today. Checkmark 1. Track your symptoms. Keep a small notebook or use a phone app to track when you feel breathless, tired, or notice fluttering. Bring that record to your doctor. It gives them clues that simple blood tests may miss. 2. Prioritize movement. Gently. You don't need to run a marathon, but walking, gentle stretching, and daily movement keeps your circulation flowing. Even 20 minutes of walking a day can lower your risk of heart events by over 30%. 3. Eat for your heart. Focus on fiber-rich foods, colorful fruits and vegetables, omega-3 rich fish like salmon, and healthy fats like olive oil and avocado. Reduce sodium, fried foods, and processed snacks. They strain your heart and raise your blood pressure. 4. Watch your blood pressure and cholesterol. Ask your doctor for a heart health check every 6 months after age 70, even if you feel fine. Silent high blood pressure and high cholesterol are leading causes of sudden heart disease in seniors. 5. Rest and breathe. Get 7 to 8 hours of sleep every night. Poor sleep increases heart attack risk by 45%. Try deep breathing or light meditation daily. It helps calm your nervous system and reduce heart stress. 6. Stay connected. Loneliness increases heart disease risk just like smoking does. So call a friend, join a senior group, volunteer. Your heart isn't just a muscle, it's an emotional center. Keep it full, and it stays strong. You hold the pen to your own story. So many people believe heart disease happens suddenly, but now you know the truth. It speaks quietly, through your breath, your strength, your hunger, your sleep, and even your mood. And now, you also know how to listen. You don't need to fear these signs. You just need to respect them. They are your body's way of asking for care, not punishment. And here's the best part. It's never too late. Your heart has carried you for 7 decades or more, through loss, through love, through every chapter of your life. Isn't it time you gave it the attention it's earned? So, if today's video helped you see things a little clearer, please leave a comment below and tell us, which of these signs surprised you the most? And what small change will you make today to protect your heart? If you haven't already, we invite you to subscribe and turn on the notification bell. We create thoughtful, practical, and heartfelt content every week, because you deserve to age with strength, grace, and clarity. Your future isn't written in stone. Every breath you take, every step you walk, every healthy choice you make extends the pages of your story. Thank you for watching. Take care of your heart, and we'll see you in the next video.
Don't let age slow you down. Stay fit with Dr. High.